Well, hello, everyone. Dr. Arabpour from the Lima Memorial Heart and Vascular Institute is here with us today to talk about the importance of addressing heart concerns as soon as possible with same-day heart appointments at Lima Memorial Health System. So thank you so much for joining us, Doctor.
Hi, Chris. Thank you for having me.
My pleasure. All right. Well, firstly, why is it critical to address concerns about the heart as soon as possible?
Well, patients may present with a variety of different symptoms. It may be something as simple as a skip heartbeats. It may be chest pain. Of course, we encourage people that when it is really a concerning issue, they don't wait and they go to the emergency room to be seen. But often, the symptoms may not be to the extent that would justify going to the ER, and that would be taking the back door in order to make their way into an office of a cardiologist and be seen. So symptoms of chest pain, lightheadedness, palpitations, or even sometimes atypical symptoms such as discomfort going down the arm, heaviness, jaw pain, and throat discomfort, which may be non-cardiac related at first. In some individuals may be a sign and symptoms of a heart problem. Okay. And in those cases, again, I advocate that patients should see a family physician or a cardiologist ultimately in order to get to the bottom of it.
Okay. So I was going to ask you what specific symptoms or medical needs should prompt someone to seek a same-day appointment for heart concerns.
So let's say this past weekend, you're sitting at home and all of a sudden you start having some chest discomfort. So you could pick up the phone and call Lima Memorial and ask for the same-day evaluation. You would be brought in on the same day. This is much beyond, far beyond what you want, perhaps your doctor would sit down and get engaged. It is involve a large amount of people that in a background, they gain access to all your medical records, things that you might have had 2 or 3 years before, in order to piece all these bits of information together so that when we sit down and we'll talk to the patient, we don't end up duplicating the test. And at the same time, we have an easier time deciding what would be the appropriate care for the patient.
Question, if patients are needing specific follow-up treatments and procedures after their appointment, well, how quickly are you able to get patients in for the care that they actually need?
You're absolutely correct. There is no point in seeing a patient and ordering a test and say, see me in a month from now. So at the same time that we have decided that this same-day visit is essential, we also have worked in order to accommodate the testing in a more expedited fashion. So if I order an echocardiogram, a stress test, and perhaps some tests may take a little bit longer, like, for example, 2 weeks of monitoring, that's the nature of it. Those testing can be often scheduled for the very immediate next day. And within a day or two of completion of those tests, you should be able to come back to the office and sit down and speak to someone like myself. And then we decide whether your workup is complete or perhaps if you need any additional testing done at that point. So we have not only devised a plan to get you to the office and be seen by your doctor, but also, as you mentioned, it's important to make sure that all the follow-up testing is done in an expedited manner as well.
Right. Now, if someone needs to address their heart concerns soon, how can they actually reach you?
They can call Lima Memorial, our office, 224-5915, and request the same-day office visit. This is true of those patients who are already established with us and they experience some problem. And obviously, we don't advocate that they sit 2 or 3 days before they come back and see me, as well as the new patients who may have had some symptoms or concerns that they would like to discuss with a cardiologist. Often, we ask them to perhaps allow us at least a couple of hours to that detective work to take place, and we can gather any relevant information they may have so that when they come to us, we have a little easier time piecing the puzzle together and probably ordering the most effective and essential tests needed.
All right, perfect. And I also want to reiterate that if people are experiencing symptoms of a heart attack out there, to call 911 right away, right?
Absolutely. Absolutely. I can't emphasize enough, and it's not uncommon for me to, unfortunately, take someone emergently to the cath lab whose spouse perhaps drove them to the emergency room. I always advise people, when you have that degree of concern, pick up the phone, call 911, and let the paramedics take you to the ER and at least exclude the possibility of something bad happening at that moment.
Right.
What we're discussing is really in order to get the care that you need, either after having gone to the ER, or perhaps if the symptoms and concerns you have doesn't reach the level that would justify a trip to the emergency room.
Right. Well, doctor, thank you so much for joining us today. I appreciate it.
Thank you for having me. Have a wonderful day.
Thank you. Well, don't go away because we have more when we return.